So the next one is the COA Health Leader of the Year Award was established in 1987 to recognize individuals who made notable contributions to the health of the nation. Contributions can be in research and administration and service delivery or some other areas of public health. It is represented to an individual who's achieved prominence and demonstrated leadership and excellence in public health. The 2025 Health Leader of the Year is, this is a fun one, guys. You ready? Is President and First Lady Jimmy and Rosalind Carter. Their extraordinary dedication to the public health has saved lives, improved health outcomes, and worldwide for decades. Through their leadership at the Carter Center, they drove one of the most remarkable public health achievements, the near eradication of the guinea worm disease. Their efforts have impacted over 500 million people across dozens of countries and advanced sustainable community-driven solutions. In the US, their leadership with Habitat for Humanity and mental health advocacy addressed the critical social determinants of health. This posthumous nomination honors their profound contributions and enduring belief in health as a fundamental human right. We ask President and Mrs. Jimmy Carter's grandson, Josh Carter, to accept the Health Leader of the Year award on behalf of the Carter Center.
Yes, thank you. Hello. Such an honor to be here. Thank you for honoring my grandparents. Their work for public health has basically been my entire life. So my name is Josh Carter. I'm Jimmy and Rosalind Carter's grandson, fourth grandchild. And I'm honored to accept the COA Health Leader of the Year award on my grandparents' behalf. I was born in 1984, so I was born after my grandfather involuntarily left politics. So when I was born, he was already a former president. So I didn't see any of my grandparents work in Washington, any official work. But when I was 2 years old, I was in the front row of the grand opening of the Carter Center. And I can't say I remember much about that day, but I did spend the next 40 years watching my grandparents build the Carter Center into what it is today. And when they started the Carter Center, my grandfather asked the CDC for a list of neglected tropical diseases that could be treated or cured or eliminated. And my grandfather's criteria about that was that it had to be a disease that we could actually affect, but it also had to be a disease that no one else was working on, the neglected part, because one of the ethos of the Carter Center was they're not going to duplicate work that is being adequately handled by another organization. And when my grandparents got the list from the CDC in 1985, I think, my grandfather looked at the list and took the top 5. So since they started the programs in 86, my grandparents tackled river blindness, which is onchocerciasis. They worked on lymphatic filariasis, trachoma, schistosomiasis, and guinea worm. And those programs have been so successful that it's kind of hard to quantify. I mean, the numbers are just astounding. For example, we've eliminated lymphatic filariasis in Nigeria. We're working on in Hispaniola. But I celebrated with my grandparents when the Carter Center delivered the 500 millionth dose of Mectizan to prevent river blindness in sub-Saharan Africa, in Latin America, and in Yemen. And for trachoma, the Carter Center now teaches a simple surgery that prevents hundreds of thousands of people from ever going blind. But I'd say the program that was dearest to my grandfather's heart was the guinea worm eradication program. And as you heard in the intro, when my grandfather started attacking guinea worm in 1986, there were 3.5 million cases of this ancient parasite in the world. And in fact, the family joke was that my grandfather lived to be 100 because he wanted to live long enough to see the last guinea worm die. And he didn't quite make it. But last year, there are only 15 cases left in the world. And this year, even though it's early in the season, there are only 2. And we know where they are. So we're very close to eradicating this disease that is so old that Moses wrote about it in the book of Numbers. We're that close to getting rid of this ancient parasite. My grandparents dedicated their lives to service, and the quote I want to leave you with is this. My grandfather said, We believe health care is a human right, especially among poor people afflicted with disease who are forgotten, ignored, and often without hope. Just knowing that someone cares about them is not only can ease their physical pain, but can also remove an element of alienation and anger that can lead to hatred and violence. So health is peace. And the work that the Carter Center does crosses all cultural, political, economic, and social boundaries. So I really want to thank you for honoring my grandparents with the COA Health Leader of the Year award. Thank you.